If a hospital wants to have a safer environment for their families, have better outcomes for their families, then they need to think about how they can effect change more rapidly. And that's what working in a collaborative does.
The average time for something that has been known in the medical literature to become common practice is 17 years. That's unconscionable. It really is.
The FPQC really works at a local level as well as a statewide level. And we impact the folks who are the most vulnerable in our society, moms and babies.
In a 2-year time period, we can assess what is a major problem for mothers and children in the state, and then over that 2-year time period, develop an evidence-based package and change behavior and truly move the needle.
People do things in different ways. It's sort of what I call the art of obstetrics, that sometimes there's not one right answer, or at least people think there's not one right answer. So you don't want people to have so many different ways that they do things, and so if the variation is like this, you want to bring it into this.
Most people want to do the right things, and they frequently think they're doing the right things, but until you actually measure it, focus on it, realize where you are, you don't ever improve.
It's not about creating new evidence. It's about taking evidence that exists and putting it into practice, implementing it in your own environment.
The FPQC really pushed forward our capability to impact women's health in Florida, particularly preterm birth and maternal mortality, the two big issues we've been working on.
The Central Line Infection Project, the Golden Hour Delivery Room Management Project, the Mother's Own Milk Initiative that we're doing now from a neonatal perspective, or the Postpartum Hemorrhage Project.
Statewide, hemorrhage is one of the top causes of moms dying during pregnancy and immediately afterwards. In fact, they find that in 60% of the cases it could have been preventable. So we started a project in which we had hospitals participate, and we helped them to figure out protocols and things that they can put in place to help prevent these hemorrhage deaths from happening.
We have been able to take hemorrhage prevention initiatives into 35 hospitals. That is impacting roughly 60% of the births in our state. What a great thing to do. In addition, we're working on prematurity prevention.
Human milk is specific to meet the needs of the human baby, especially in the premature baby. So by promoting mother's own milk in the NICU and promoting breastfeeding, we are promoting the health of the infant as well as the health of the mother, and we're doing cost savings for the hospital.
Now you think about that as cost savings for health, and that seems impressive, but you're now also talking about the quality of health and health care that someone gets. So babies are less likely now to die, less likely to need neonatal care or stay in a neonatal unit, and have a better chance for life.
By us getting into the hospitals, getting this educational effort to everyone in the hospital, the nurses, the doctors, the administration, the pharmacists, everyone, we're able to create change faster.
I want to thank the Florida Blue Foundation and what it means. One, you've recognized the quality of the work we do, which can make us feel good, but two, we can show others that we do the type of work that's going to make a difference in the lives of moms and babies.